Us now to Belfast and Rita Devlin at the Royal College of Nursing. Thanks so much for being with us, Rita. At first, give us, if you will, a better understanding of what the serious psychological stress has been. What are nurses really struggling with?
I think nurses are struggling with a lot of things. So, firstly, we had the first outbreak, if you like, at the start of the pandemic, and we started that with the, if you like, the hero narrative of the nursing staff going to basically some of the war analogies that were made, and the hero narrative, the clapping during the week, and they were buoyed up, I suppose, at the beginning of that in terms of doing whatever they could to help out. As the situation unfolded and the longer the situation went on, we started to hear of our nurses being fatigued. There's physical fatigue with working with PPE for long periods of time, and there's physical fatigue with long shifts and possibly not taking breaks and getting time for breaks and hydration and nutrition. But there's also the mental and emotional strain of working with people who are so ill, and the inability of nurses to comfort patients and families when there was the inevitable deaths. And that has taken its toll because, as you know, even within Northern Ireland, in the worst of the troubles that we saw, we were always able to bury our dead. So that has had a huge impact in Northern Ireland culture. We have wakes and we celebrate death, and it is a big cultural issue for us. So that has compounded a lot of the psychological stress that our nurses are feeling.
It's so, upsetting. Especially, all of it is disturbing, but when you talk about the PPE issue, there are two very upsetting angles to that. And in this study, in 130 countries, in some countries, they're seeing the fact that nurses still can't get proper personal protective equipment. And then in other countries, like
Yes.
you were citing, some of the equipment that they have to wear for, upwards of 12 hours a
Yes.
day, and the stress that puts on their body, being basically in hazmat suits. I can't imagine having to work in that kind of constricting and suffocating equipment the way they do day in and day out. So the issues with the PPE really are underappreciated on so many levels, are they not?
They are. They do add. They add to the sort of physical tiredness because nurses get dehydrated, and if you are in full PPE and you need to go out to have breaks, then obviously you're have to take the PPE off and then you have to put it back on again. And there is that idea that is it worth taking it all off for 5 minutes for a drink of water or whatever. And so self-care does sort of take a back seat in pandemic, and that all adds up with the physical and the emotional stress that people are under. We just came out of phase 1, and then our nurses were straight into trying to rebuild services again, and people who were redeployed were back into their own areas. And just as we were starting to get services rebuilt, we're nearly back into the second surge again, and nurses are being asked to redeploy yet again to areas that they're not familiar with. That is very worrying because obviously they want to deliver safe care, and as professionals, it does impact on them if they think they're not given the service they require.
Right. Rita, unfortunately, we're going to have to leave it there. I wish you all the best, though, and hopefully things will start to change for our healthcare workers. It needs to. Thank you so much for
Okay,
being
thank
with
you.
us.